There are different types of radiation treatment, and they vary by administration, location of radiation, and amount of radiation. And doses are made in grays, which 1 gray is the amount of radiation energy absorbed by 1 kilogram of tissue. The type of radiation used depends on many things. The type of cancer, size of cancer, location in the body, how close the cancer is to normal tissue, how far radiation needs to travel in the body, patient's health and history, combination of other cancer treatments, and any other conditions that patients may have. There are 3 main types of treatments: external beam radiation therapy, brachytherapy, and systematic radiation. External beam radiation therapy uses photon beams, usually X-ray or gamma rays, since those have the highest energy. This therapy commonly uses a LINAC machine, which is a linear accelerator shown on the left. There are many different types of external beam radiation therapies, and I'll talk about a few of them briefly. First is 3D CRT, which is 3D conformal radiation therapy. This is the most commonly used, and it involves sophisticated computer equipment and machines. IMRT allows different doses to be administered to tumor versus normal tissues. This reduces side effects, but it allows for more normal tissue to be exposed. IGRT is radiation therapy that's image-guided. This takes imaging scans throughout the treatment to allow adjustments to be made. This increases accuracy of targeting and decreases the total amount of radiation exposed to normal tissue. Another type of therapy is tomotherapy, which uses the same machine to take imaging scans and to deliver the radiation treatment. This allows for more precise targeting of the tumor and reduces exposure for normal tissue. There's also SRS, which is stereotactic radiosurgery. This delivers high doses of radiation to small tumors with well-defined edges, such as in brain cancer. This allows less damage to normal tissue, however, the patient positioning is very critical. Stereotactic body radiation therapy, or SBRT, is used on small lung or liver tumors. This uses a smaller radiation field and higher doses than 3D CRT. This allows for fewer sessions with pinpoint accuracy. Proton therapy is very useful because the charged particles don't deposit their energy until the end of their path. This significantly decreases the normal tissue exposure. Just look at the comparison between normal radiation therapy on the left and proton therapy on the right. The red represents high-dose radiation, which attacks the tumor location, and the blue-green represents the normal tissue that's being exposed by lower doses. Now you can see that on the right, there is much less normal tissue that's affected. Another kind of radiation therapy is brachytherapy, also known as internal radiation therapy. This is when radiation sources are placed inside the body. They're usually administered through needle, catheters, or other carriers. The sources are isotopes that are sealed in pellets or seeds, which decay and give off radiation to cancer cells. There are 3 main types of brachytherapy. First is interstitial, which places a source directly in the tumor tissue. There's also intracavitary, which places the source in a body cavity near the tumor. And there's episcleral, which treats eye melanoma. Brachytherapy can either be temporary or permanent. Temporary is when sources are delivered and then removed after treatment. In permanent, however, sources are sealed in the body and not removed after radiation. Brachytherapy also has different dose treatments. A low-dose rate treatment gives cells low radiation over several days, and a high-dose rate treatment attaches the patients to machines that deliver and remove sources of radiation. This allows for fewer treatments. Another type of radiation therapy is systematic radiation. This is when the source of radiation is swallowed or injected and it travels through the body's bloodstream. The radioactive substance is usually bound to a monoclonal antibody. This guides it to its target. And a common type used is radioactive iodine, used in thyroid cancer.